Hello and welcome to this video tutorial on neonatal screening. We're not going to cover the entirety of neonatal screening, but we are going to cover the blood spot test, otherwise known as the heel prick test or the Guthrie test. So what will you know by the end of this tutorial? You'll know when the heel prick test is done. You will be able to list all the different conditions that we currently screen for, and you will have a brief understanding of each one of these conditions. The parents of every newborn baby are offered for their baby to have the heel prick test. The parents can refuse the test, and the test is usually done between days 5 and 8. It is usually done on day 5 though. Don't forget about the Wilson and Younger criteria. As with any other screening test, the newborn screening test must fit the Wilson and Younger's criteria. Screening can certainly prevent morbidity. This is the most important phrase that you have to remember, because this gives the main conditions that are screened for. This is a really useful mnemonic that I've made up. Screening can certainly prevent morbidity. So we screen for sickle cell disease, congenital hypothyroidism, phenylketonuria, medium chain acyl-CoA dehydrogenase deficiency. Now I know you're all sat there thinking, oh, what? Medium chain acyl-CoA what? Don't worry. MC Ad is in the house. So it used to be the case that just these 5 diseases were screened for, but in May 2014 it was recommended by the UK's National Screening Committee that 4 other inherited metabolic diseases were added. And well, MC Ad is gonna add another mnemonic so that we don't forget the inherited metabolic disorders we've got to screen for. So MC Ad adds that screening may greatly help infants. So the screen for inherited metabolic disorders are maple syrup purine disease, glutaric aciduria type 1, homocystinuria, and isovaleric acidemia. Sickle cell is an autosomal recessive disorder, so it's genetically inherited by both parents. Most commonly seen in African and Caribbean people. In sickle cell anemia, the red blood cells aren't flexible or disc-shaped. Instead, they're very rigid and shaped like a crescent or a sickle. So because of the shape of the red blood cells, they're more likely to get stuck in the vessels. This can cause tissue and organ damage and a lot of pain. Early identification can make sure that a suitable management plan is put in place with details such as keeping hydrated or, for extreme pain, given hydroxycarbamide. Cystic fibrosis is an autosomal recessive disease again, so 1 in 25 people will be carriers of a mutation which leads to cystic fibrosis. In cystic fibrosis, there is a faulty cystic fibrosis transmembrane regulatory protein, so this leads to dysfunction of chloride and sodium secretion. And we know that if we're not getting the chloride and we're not getting the sodium out, then water isn't going to follow. So consequently, you get a build-up of this thick mucus, which is ideal for harbouring nasty bugs such as Staphylococcus aureus, or more seriously, Pseudomonas aeruginosa, or Burkholderia capaceae, amongst many others. There are also implications for the gastrointestinal tract, the pancreas, the bowel itself with obstructions, and there are problems with fertility. Often the vas deferens will be absent in males. Early identification of cystic fibrosis is really important so that you can then devise a management plan. So prescribing prophylactic antibiotics, physiotherapy, nutritional support, all are really important. In congenital hypothyroidism, there is a lack of thyroid hormone present from birth. This will most often be a result of a thyroid gland problem. It may be missing, ectopic, or just poorly developed in 75% of the cases. More rarely, it'll be caused by problems with the pituitary gland or with the thyroid hormones themselves. Untreated congenital hypothyroidism can lead to spasticity, gait defects, dysarthria, and mental disability. And the treatment will be thyroxine replacement. Phenylketonuria is yet another autosomal recessive disorder, and this one's a metabolic genetic disorder. Normally, we have a hepatic enzyme, an enzyme in the liver called phenylalanine hydroxylase. Its job is to convert phenylalanine into tyrosine. In phenylketonuria, the phenylalanine hydroxylase is non-functional, and so we don't get phenylalanine being converted into tyrosine. Instead, we have an accumulation of phenylalanine. A build-up of phenylalanine can lead to intellectual disability, can lead to seizures, mood disorders, and possibly ADHD. So of course, it's really important to identify phenylketonuria really early on so that we can restrict phenylalanine from the diet and give any additional supplementary amino acids. Now for our friend MC-AD, so medium chain acyl-CoA dehydrogenase deficiency. We want to imagine MC-AD to be really fat, because when we say MC-AD, we want to think about fat breakdown, although people with MC-AD won't necessarily be fat. So MC-AD is an autosomal recessive disease again, and it causes problems during illness or starvation, and the body's unable to break down its fat supplies. People with this disorder require emergency regimes, so if they become ill, then they have this special drink, which is like a glucose drink, which allows them to have sufficient energy. In maple syrup urine disease, there's a problem with the breakdown of 3 amino acids, so leucine, isoleucine, and valine. So a build-up of these amino acids will occur with excess protein, and so a low protein diet with special supplements will be required. In glutaric acid urea type 1, there is a faulty breakdown of lysine and tryptophan, so again, a low protein diet, and this time carnitine is required. In homocystinuria, we cannot break down the homocysteine, so this can lead to a build-up. A build-up can cause learning difficulties and eye problems. The bones may be abnormally thin, long, thin and weak due to osteoporosis, and blood clots and strokes are more common. We might give vitamin B6 pyridoxine in this situation. So valeric acidemia is another autosomal recessive metabolic disorder, and it results in the abnormal metabolism of the amino acid leucine. And so a build-up can lead to poor feeding, vomiting, seizures. So never forget, screening can certainly prevent morbidity. MC-AD may greatly help infants.